Hi, I'm Lori Crow, and I'm here today with Angela Meyers from the Medical Healing Center here in Tallahassee, Florida. And I'm very excited to share Angela with you today. She is a nurse practitioner who has made a revolutionary decision to move from traditional medicine to include alternative medicines. And I'm just excited for her to share why she made that decision and what that entails. Angela, thank you so much for meeting me today.
Well, thank you for asking me. I love to share my story, as it were.
So would you tell everyone what got you started?
Well, I got started, I was actually an RN at the time, and I developed rheumatoid arthritis in the early 80s. And probably about 3 years into that, I was told by a rheumatologist that I was going to have joint replacements, I'd be in a wheelchair, and I'd have a lot of pain and need to be on all these medications. And I just looked at him and I said, you know what? I don't think that's gonna be, it's not gonna happen. And so I went to a colleague, and actually I was not an RN, I was a nurse practitioner, because I went to one of my colleagues, Elizabeth Markovich, who's actually a friend too, and she's a nurse practitioner. And I read this book. It's called The Road Less Traveled, and it talked about possibly having an infection in your joints and different things like that, and talking about alternatives and how to get inflammation down, about diet. So I went to Elizabeth, and Elizabeth helped me. She put me on some antibiotic, and my history was I had chronic strep infections. And strep actually can get into the joints. And so we started treating that. At first it was really painful because in the joints, the infection, the organisms would die off and it would go into the tissue, and it was pretty painful for about 3 months. I stayed on the antibiotic for a little over a year, and my joint pain went away. I have a little bit, I don't know if you can see my thumb, a little bit of curvature in my thumbs. That's the only thing that I have. But we also did a lot of other things. We looked at my diet. I cut out gluten. I cut out the nightshades, really watched what I ate. I started doing some exercise. Actually, I just started taking care of myself like I was telling my patients, and guess what? It really works. And so, funny story, but, but it's true, right?
So
you need to really take your own advice sometimes. So anyway, that's how I got into it. And then the other thing that happened to me was I was working for a clinic, and I was seeing women in there, young women, and they had bacterial vaginosis. And what I began doing with them, the same thing I was doing with myself, was to really alter their diet. Well, I actually cut down the carbohydrates and the sugars, and I got in trouble for that because I was changing the food pyramid. But I was healing the bacterial vaginosis. They quit getting that. And we did probiotics, and so I actually got reprimanded for that. And now the food pyramid is actually changed to have more protein and less carbohydrates. So I just thought, this isn't the road for me. And so I started my own clinic in 1999, I believe. And it's evolved mostly because of the wonderful patients I have. They are like, I have this need, what can I do about it? And we would research it, they would bring research to me, and it's been just a wonderful, experience.
That is amazing. So, and it's really grown because you have, we're going to talk about all the services that you offer. I want to hear all of that. You also have a functional medicine doctor here. You have, please tell everybody the different practitioners that you have and what services you offer.
Okay. We've got Dr. Diebel, we call her Dr. Ola as a nickname, and she does functional medicine. She's family practice, and she's just amazing. Her claim to fame is gut health, and honestly what I found out through the years is that if your gut's not functioning right, your immune system's not working, and it affects your whole body because you get leaky gut and inflammation goes out. So you've got to treat that. Anything that's functionally wrong with that. So she does functional medicine. We just added Celeste Lynn, who's a nurse practitioner, and she is very knowledgeable. She does pediatrics, so we're now seeing children in our practice. She does women's health and can do just about anything with women's health, a lot of the procedures. She also does joint injections, so she can do one of the therapies that we do, which is Prolozone injections, and we'll talk about that in a minute. She's doing weight loss. She just does a lot of different things, and she's got a lot of experience. So she is just a welcome addition to the practice, and on top of that, she's just really likable and funny. So you'll like her. So that's good. It always helps, and very personable. There's myself. I'm a nurse practitioner. My specialty kind of has involved treating Lyme disease and chronic illnesses, autoimmune dysfunction, and I'm kind of really good at that. So I do also bioidentical hormones, and Celeste does that too, and also Dr. Ola. We just do so much. Sometimes I can't remember it. So those, and then we have Eric, who is my husband, and he's actually helps in the practice, and he does energy medicine. And he does a form of energy medicine called the QXCI or SKIO, which is like a very elaborate biofeedback. But Eric helps us really find what's wrong with the patient if we can't do it, because this machine can actually interact with your body energetically and tell us what's going on with your body at that point. It also does energy correction in your biofield or in your energy field, which is very important these days, being around a lot of Wi-Fi, fluorescent lights, all that kind of stuff. So,
which we're around right now.
Yeah, which we're around right now.
Right.
And also we do have an infusion center. I kind of started that back when, I would send people to other places to get infusions, and they just didn't get what they needed. So we started that when we do a lot of infusions which are IVs.
Okay, well it's incredible. And I've, experienced your practice myself. And so I do want to share that, when you come in, I have been to traditional allopathic medical facilities, and I've been to alternative medical facilities. And what my experience is, when I came into the Medical Healing Center, I felt like I was the one that was important. My entire body was being looked at. It wasn't just, okay, what's your one problem that we want to deal with today? And so I felt heard. I felt like Dr. Ola really spent long time with me to figure out what my needs were. And so that was very, very unique to me, was the amount of time, the amount of energy, the amount of effort, and the fact that it wasn't, the questions would be so deep into, what are you eating? How are you sleeping? Tell me about your gut. Tell me about what's going on, looking at my blood work. It was this whole comprehensive package that really made me feel like we were trying to get to the root of the problem rather than just getting rid of the symptoms. And so that was something that really impressed me. And you've mentioned quite a lot of things. Mm-hmm. And so would you just pick a couple, the Prolozone therapy and the IV therapy, and just educate us a little bit about the benefits of those two particular processes?
Yeah, well, I'll talk about the infusion therapy program. The reason that we started that was because a lot of people who have chronic illness and autoimmune dysfunction or dysfunctional GI tract, that just their GI tract isn't working, they really can't get the amount of nutrients or antibiotics they can't take because they get like an overgrowth and they already have one. So we started doing infusions to bypass the gut and to really treat very quickly. and efficiently without doing more damage to the digestive system. And so it's worked out very, very well. And we also do infusions for alternative cancer. We do the high dose IVC. We do the IVC to build the immune system. We have immune IVs.
So what is IVC?
Okay.
For those who don't know.
Yeah, I know. I talk like that, and people go, "What are you talking about?"
Right.
Well,
just
okay.
For the lay person.
Thank you for that.
Yeah.
It's IV vitamin C,
Mm-hmm.
and so we use the sodium ascorbate, which is very good. We like to use that because it really doesn't cause kidney damage like some of the other forms of C. You can give it very rapidly. When you want to do an alternative cancer IV, you want to kind of give it a little bit more rapidly so you can do the big bang for your buck, as it were, on killing cancer cells, and it won't damage the kidney. So that's vitamin C in a kind of a quick nutshell.
Okay.
So we do hydrogen peroxide IV, we do hydrations, we do anti-aging.
So why would you do hydrogen peroxide IVs?
It's very, very good. It's like an oxidative therapy, so it's going to produce oxygen.
Okay.
And it also is very, very good for killing just about everything known to man, as far as pathogenic organisms or organisms that can cause disease.
What are the typical patients that would use that?
You can actually use it as an oxidative therapy, so anybody can really come in and get that.
Okay.
You can use it like if somebody has like Epstein-Barr virus, or even if they've gotten the flu, they can come in and get that.
Okay.
They can also do IVC, and then we have the IV ozone as well, which are pretty compatible too. So they do actually the same sort of things.
So I did come in here in the early days when COVID was just getting popular, for a lack of a better term. And I had the IVC, and it was very simple. It was, it was very relaxing, and I felt wonderful. I feel like, it really empowered my system. And that time when I needed to give my immune system a boost, that it was just a really good, helpful, I guess, methodology,
Yeah, it really is. It's amazing, and it's also makes your skin look great. So
we're all about that, aren't
we are.
Okay.
So we just do I can go on telling you all the IVs we do for anxiety.
Which one do you do for anxiety? We have a lot of people with anxiety, don't we?
Yeah, it's a formula, so we have different things in there.
Okay.
We use some magnesium, which helps that, some amino acids and different things like that in that formula.
Okay.
We do nutritional. We do, we actually have an ophthalmic one that can help macular degeneration.
Wow.
So there's just many, and the reason we have all those is because when you look at disease or symptoms or problems, you really have to look at the patient on an individual level.
Right.
And so there's not really one IV that's gonna, well, maybe there is, maybe C and IV ozone, and
Right.
those are really two which I order a lot because I think everybody really benefits from those. But they may have individual like nutritional needs and different things like that. So the IVs you get with us are going to be pretty individual for what your needs are and what your symptoms and your problem is.
So if you would tell us about the Prolozone therapy, and then I'd like to ask you what an appointment would look like, because probably some of the people watching are going to want to know, does this start with blood work, or do we go through? So we can go through that process of what an appointment would look like. But the Prolozone therapy has just fascinated me, and
it's amazing.
So please share what miraculous things this Prolozone therapy is doing.
Well, Prolozone therapy, it's an injection, and you well, let me just back up a little. So when you come in and you have pain, what pain is usually caused from is from a lack of nutrients and a lack of oxygen. And so what we do is with the Prolozone, we put nutrients back in, and we put oxygen in the form of an O3 molecule, or ozone. And why we do the O3 molecule is it's really the only way that the body can accept oxygen in the body. Because what happens is an O3 molecule, I hope I'm not getting too technical because it's very boring when I do.
No, you go
But
right
anyway,
ahead. We want
you
to
can just
know.
like fast forward this part if you don't want to hear it.
It's good. It's good information.
But anyway,
Yeah.
an O3 molecule is an unstable molecule. And so you get the O3 in, and then once it goes in, it breaks off into oxygen, that's the only way the body can really accept oxygen in tissues and in the veins systemically. And so that's what we do. So you come in, I'll just give you an example of a patient.
Okay.
Came in and could not lift his arms over his head until like about this. It hurt, and one shoulder was worse than the other. And so I did 3 or maybe it was 2 shots, and right after I did those shots, he could raise his arm up and he didn't have any pain. It's just quite amazing. We see miracles. So ever since that day, this patient, he couldn't sleep on his shoulders because of the pain.
Right.
And he went home, and his wife comes with him. So I get, women always give me the real lowdown.
Right.
Sorry, guys, but
It's true. It's true.
You need women, okay? So,
I didn't say it. She did.
because they take care of you. So anyway, physically, and there's studies out there that say if a man is married to a woman, they're going to live longer. Well, yeah, that's true. And here's an example. He brings his wife in, and right after we gave him the Prolozone, he slept that night. He's been sleeping ever since. He's able to raise his arms. And I find that when people get that kind of result, they want to come back, every 2 weeks. And I'm like, no, let's just wait till the pain, comes back.
Right.
So I'll gradually lengthen I won't do it any sooner than 2 weeks. Because I want to see the full results from that. But so I've gradually moved him out. He's at 6 weeks now, and he has had no pain. So hopefully we can go even further, But
That's
Prolozone
amazing.
actually repairs ligaments, tendons, and joints, and it decreases inflammation in the body as well. I see it has, I kind of swear it has more systemic effects than just in that joint. And when you look at Prolo, it's a liquid, and you look at oxygen, it's a gas, and it seems to have an affinity for an inflammation. And I think it just goes to other places as well, because we've seen other things occur after we've given the Prolozone in other parts of the body. So it's pretty amazing. And I did train with Dr. Schallenberger. I'm actually certified in beginning and advanced. And I did work with him in his office a day, and he's an amazing guy, and he's actually the inventor of Prolozone and took a lot of the technology from Germany.
That is incredible. So, these are some things that we don't normally hear about in the mainstream, and so I really, really wanted you to be aware that there are these things for my Tallahassee peeps right here. But you can look online if you are not local, because there are many, many people in our team. And just what would they want to look for? What would they, if someone was from another city and they're trying to find alternative medicines, what are the things that they're going to want to seek out to find a place that is really highly qualified, reputable, and offering a similar type offerings?
I think just if you look up integrative therapy or alternative therapy, or you can look up oxygen therapies if you're interested in Prolo and other areas. And we actually see people from all over. So, we're open to people from other states. I think the furthest I've seen a patient from is from Italy.
Okay, I was going to say we have people from New York,
Yeah.
but at least farther. So
Yeah. And so so we're open to everybody. But
right.
those are what you can Google, and our website is called the Medical Healing Center at Comcast.net. No, that's our email. It's the Medical Healing. See, I'm not very techy, okay? I just have to.
I will put it in the description below.
I don't know what it is. I just work there.
I will make sure that you are connected with all of this amazing goodness, because this is where I come. This is where I take my family. I recommend it to friends. Lisa, whom you all know and love, she is now coming to the Medical Healing Center. And it's because I believe that there is a place for allopathic traditional medicine, but I always want to start with prevention or with an alternative method that is less invasive. And that's what's so important. I want to get it on a cellular level, healing. I don't want for me to go in, I have a stomach ache, and we're going to start taking something to get rid of the stomach ache. I want to know why I have a stomach ache. And I think a lot of you feel the same way. You're looking to solve the deeper problem, right? So this is an incredible resource right here in town.
Thank you.
And just some other, like, this is just logistical, but I wanted to ask, what kind of insurances do you accept here?
I know Blue Cross and Blue Shield. We do Medicare primary. I tell you what you can do. You can call our number and ask for the biller, and she can tell you, because I really don't know. That's really kind of screened at the front.
Right.
So
we just want you to know that, that there are some mainstream insurances also that Blue Cross Blue Shield is or Florida Blue or whatever, those are mainstream insurance providers that you can come to this facility and have alternative solutions to your problems. I had my woman's well visit here, and it's just it's a beautiful, clean experience with professionals that are offering the full gamut. They have the traditional to offer to you, but they also have more medical options in their tool belt. And that, to me, is what makes your practice so powerful.
Thank you.
So I just want to thank you so much, Angela, for taking the time out to kind of share with us your passion, why you started this, and to let us know what it is that you offer so that we can benefit. Because, we always want to be educating you and sharing the goodness that we find. So Lisa and I, we're always scaling out there, and we're looking for information to teach, to train, and to share to make your health journey more holistic. Something that takes it from the inside out instead of from have a problem, find a solution. So I just can't thank you enough for your time. I can't thank you enough for sharing all of this with us. And I hope that many of you will find benefit from this information. Like I said, I'll have the website down in the comments, and any other, maybe I'll put the information about Prolozone down in there and the IV therapy, because there are links that I can provide for that as well. So thank
you for doing the work you do.
Oh, thank you so much.
I appreciate it. Good work.
Thank you. So we work really synergistically together. Anyway, thank you, everybody. I hope you have an incredible day.